Happy Monday evening, December 21, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. Let's begin. We have a lot of news to get to this Monday evening, so let's get started. First up, we're going to begin with COVID-19 updates. More than 800 new cases of COVID-19 announced. No new deaths or hospitalizations. State health officials announced 847 new cases of COVID-19 on Monday, though many were actually reported in the past 5 days. And now let's take a look at New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 37,388 number of people in New Hampshire have tested positive for COVID-19. 17,947,644 number of people in the United States have tested positive. 656 number of deaths from COVID-19 in New Hampshire. 889 number of people who have been hospitalized with COVID-19 in New Hampshire. And 602 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 514. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 3298. And let's take a look at these three charts here. With the first chart here, new cases each day in New Hampshire in the purple, daily new positive COVID-19 cases, orange, new hospitalization, and red deaths. Let's take a look at this chart here, current cases in the purple, total current COVID-19 cases, and orange, current hospitalization. Let's take a look at this chart here, total cases in the purple, total positive COVID-19 cases, orange, total hospitalization, red deaths, and blue recovered. And let's take a look at this chart here, positive PCR test rate, and positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here, age group of cases, and female and male of cases. And let's take a look at this chart here, infections, hospitalizations, and deaths. Let's take a look at this chart here, deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. St. Joe's Basket Project helped families despite pandemic. Decades-old tradition provides gifts to families in need. Let's take a listen to that video from WMUR News 9, Amy Cavino.
This year, I got the most unique gift for the holidays. My wife gave me a Fleet Air Club membership for Christmas.
There was a point where I didn't think this would happen.
In a year when healthcare workers have battled a deadly, unrelenting virus for 10 long months, no one would bat an eye if this holiday gift program took a pause.
Maybe one in there.
But the staff at St. Joseph's Hospital refused to let COVID steal one more thing.
Every bump we hit along the way, the staff stepped up to say, fine, well, what do we need to do to make this happen this year?
Collins says the need was bigger this year than ever. 59 local families, 120 children, and 16 foster young adults who have aged out of the system and could be feeling more alone than ever.
They get both what they need and what they want.
Boxes upon boxes, wrapped, blessed, and hauled out for delivery. A logistical effort that would impress Mr. Claus himself.
Knowing, that you did good and that a child is going to have Christmas and is going to keep that spirit of Christmas and that joy and that belief and be none the wiser.
Another twist this year, most of the families who applied had never been in a position of need before now. Another casualty of a terrible, relentless virus. But giving back, it turns out, is a powerful antidote.
It's our legacy.
And the Nashua Police Department and the Salvation Army chipped in on this effort to help deliver boxes today. Reporting live this noon, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Hassan colleagues win approval by end to surprise medical bills and comprehensive end-of-year deal. Shaheen was again involved in small business portion of COVID-19 relief. A long-sought provision to end surprise medical billing championed by Senator Maggie Hassan has made its way into the $2.3 trillion end-of-year congressional agreement that includes a new $900 billion COVID-19 relief package. Hassan, more than a year ago, joined with Republican Senator Bill Cassidy of Louisiana to co-author the Stop Surprise Medical Bills Act. According to Hassan's office, the legislation would address costs that patients are billed for after receiving care unknowingly from physicians or hospitals that are out of the patient's network, often in emergency room situations. CNN cited a Kessler Family Foundation report stating that 1 in about 6 emergency room or hospital admissions result in at least one out-of-network medical bill in 2017. Hassan found an ally on this issue in President Donald Trump. She and Cassidy joined Trump at the White House event in May of 2019, supporting an end to the practice. Earlier last year, Hassan hosted at Trump's State of the Union address Donna Beckman of Seabrook, who received a surprise medical bill for $1,648 2 years earlier following a visit to an emergency room that was in her network. According to Hassan's office, Beckham was told later that a doctor she saw for about 5 minutes was actually out of the network. The Hassan-Cassidy bill had originally been planned to pass and sent to Trump last year, but it ran into a roadblock in the House. According to Hassan's office, about 2 weeks ago, an agreement was reached among the Senate Health Committee, on which Hassan and Cassidy served, and 3 relevant House committees. Hassan and Cassidy, along with Republican Senator Lamar Alexander and Democrat Senate Patty Murray, led a letter by 27 senators to Senate Majority Leader Mitch McConnell and Minority Leader Chuck Schumer last week urging passage. Hassan, as well as her New Hampshire colleague Senator Jeanne Shaheen and other senators, had been targets of advertising opposing an end to surprise medical bill by a dark money group affiliated with private equity-backed companies that own physician practice that staff emergency rooms around the country. The bill was finally included in the $2.3 trillion spending package that was unveiled Monday afternoon and was expected to be approved Monday evening. According to Hassan's office, it provides that regardless of where patients receive emergency room care, they will only be responsible for their in-network sharing amounts. If patients take an ambulance or air ambulance, they will only be responsible for their in-network cost-sharing amounts. If a patient seeks non-emergency care at a network facility, but one of the providers that they're not able to choose is out of network, such as an anesthesiologist, the patient will still only be responsible for in-network cost-sharing amounts. The bill also set up a process to resolve payments despite in such situation between healthcare providers and insurances, with patients taken out of the middle, according to Hassan's office. In a joint statement, Hassan and Cassidy said this. Let's take a look at that joint statement. And here is that joint statement. Hassan Shaheen priorities. Meanwhile, Hassan and Shaheen said their overall priorities were included in a massive package. Hassan said she was involved in negotiations for expanding unemployment benefits relief for K-12 schools and higher education institutions and U.S. Postal Service funding in the $900 billion COVID-19 relief price. Shaheen said that she was earlier in the year for the CARES Act. She was involved in negotiations that resulted in provisions to help small business hurt by the COVID-19 crisis. Hassan said she was also involved in small business relief as well as the stimulus payments and expanding the current year-end deadline for states to use CARES Act money through 2021. Outrageous Congress cutting line to get vaccine, Sununu says. Governor Chris Sununu said it was outrageous and insulting that members of Congress, such as U.S. Rep. Annie Kuster, a Democrat of New Hampshire, were cutting the lines to get the coronavirus vaccine ahead of more needy New Hampshire residents. Concord teacher on leave during online solicitation inquire. A Concord high school teacher was placed on leave after a former student made an accusation of inappropriate online solicitation. A Concord high school teacher has been placed on leave after a former student made accusations against the teacher, claiming they were involved in inappropriate online solicitation, according to Kathleen Murphy, the interim superintendent of the Concord School District. The accusations against the teacher was made to an administrator in the district Wednesday. Based on the information, she said Concord Police and New Hampshire Department of Education, which handles educator certificates and accusations against school employees, were notified. Because the allegations concerned possible criminal activity, Concord Police assumed jurisdiction of the case and have been working closely with district leadership, who are conducting their own internal investigation, she said. The employee in question has been placed on administrative leave pending the outcome of the investigation and is prohibited from being on district property. Neither Concord Police nor Murphy were available for comment before post time, since the incident is a personnel matter and an open criminal investigation. Limited information about the case is available. Murphy, in an email to parents, said the safety and well-being of SAU 8 students and staff is and will remain our number one priority. She said updates would be forthcoming to the exact possibility while balancing the previous interactions of the employee. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching this evening edition. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.